Hello everyone. In this video, we are mainly going to discuss the relationship among different organs. And before we introduce, we still have one part of the orifice we didn't introduce in the previous video, the eyes. So the function of the eyes is actually we see everything from the eyes, and the eyes related to all different organs. And these, as you can see from the picture, these are the theories from eyes inspection. Also, when we want to see the spirits or how energetic the person is, we also see from the eyes. That's also the diagnostic methods from the eyes. When the diagnostic methods, we always says that we need to see the spirits of the person. How can we see the spirit of the person? We see from the eyes. We see the shape or the appearance of the eyes. That reflects, it's actually not the spirit, but it reflects the 脏腑 condition from the eyes. Why we can see the 脏腑 conditions from the eyes? That's because the different parts of the eyes related to different organs, such as here the eyelid, this area related to the spleen, so the upper and lower eyelids related to spleen, the pupil related to the kidney, the dark parts related to the liver, and the white parts of the eyes related to the lung, the corner, canthus related to the heart. So that's how we diagnose from there. From a physical person, the eyelids, the upper, lower related to the spleen. That's why in some condition, if some patient their eyelids could not move, could not lift, so they always drop the eyelid to here. They need to use their fingers to lift the eyelid. In this condition, we will focus on the treatment of the spleen because the eyelid related to the spleen. And also the white parts of the eye here, both sides. These are related to the lung, so we can see the condition of here, see the lung, and sometimes you can see the blood vessels in the white parts. Now in this condition, we can conclude that the blood vessels is the red color. The red color is yang. So in this condition, sometimes we will think that this is the lung fire, so or lung heat. So excess heat in the lung, and then it reflects from the eye. That's why we inspect from the eye to see the lung condition. And also in the corner, these two corners are related to the heart. So this is the theories from the observation of the heart, of the eyes. How we diagnose, we're going to study more from the diagnostics. But that's the relationship, and also from these we will see that the eyes, the orifice of the lung related to all different organs. So the next topic, we're going to talk about the relationship among organs. These are actually the examples we gave you. We helping you to understand the function of these organs, the function of the 脏象 theories, how we going to use these theories to analyze the phenomena in different organs. So the first relationship we're going to discuss is the heart and the lung. The lung assists the heart to move the blood. The heart assists the lung to distribute the qi. So the heart, the circulation of the blood. The heart governs the blood. The blood can nourish the lung. The blood, the circulation of the blood need the promotion or the force from the heart qi, but the lung governs the qi of the body, which also includes the heart qi. You see, this is the relationship between the heart and the lung, but also apart from here, this is one example that when we discuss the relationship between one to the other, you need to find the agents between these two. The heart related to the blood, the lung related to the qi, and the qi, they related, the qi and blood. That's how to analyze the relationship between these two. Also, you can understand the relationship between the position, where they are. The lung and the heart, both of them stay in the upper jaw. The heart governs the blood, the lung governs the qi. So these two, the blood and the qi, they all from qi. We should still remember that's where does the blood come from? The middle jaw receives qi and then transfer to the heart. The heart transforms the qi into red color. Then this red color substance we call blood, right? So that's the formation of the blood, also from the qi. The heart governs the blood, which includes the movement of the blood. The lung governs the qi flow, which the blood movement also rely on the qi movements. So as you can see here, there's a lot of connections between the heart and the lung in terms of the qi and blood, the position. So there must be many connections between these two. And also when we study in future from the relationship of the qi and blood, we also can analyze from the relationship between the qi and blood, such as the qi is the commander of the blood is the carrier of the qi, which means the blood is the vehicle of the qi. The heart qi need to move. You need the vehicle of the blood. That's also the relationship between the heart and the lung. That's also why in the pathological changes, the lungs problem, someone suffer from lungs problem, will also affect the heart, such as the lung deficiency will result in the heart blood deficiency, or the blood deficiency also can result in qi deficiency and result in blood stasis. These are due to the relationship between the heart and the lung. So in order to study the relationship, we can study from the position of the physical body, the relations, we find the agents, also from physiological condition, pathological changes, and also the relationship of the essence, blood and qi. So you can understand the relationship between different symptoms. Pathogenic conditions. A patient with the chest pain, oppressed chest, difficulty breathing, panting, in all these symptoms, if it happens in one patient, what's the pathology, the heart deficiency, which we call the poor circulation, and then we have the symptoms of the chest pain or perched chest, also the indicates the heart yang deficiency, and then the poor circulation can result in stagnant blood. The static blood can cause difficult breathing and panting. These actually the static blood in the lung. So this from the heart affects the lung. That's caused the upper chest and difficult breathing. So this is just one example of the pathological changes. The second is the heart and the lung. The heart and the spleen. So this will focus on the production of the blood or the formation of the blood, the movement of the blood. So these two aspects, the blood and spleen. That's the blood is the agent between these two. The heart governs the blood. Where does the blood come from? That's from middle jaw, which is spleen and stomach. So that's the relationship. The sufficient blood can nourish the heart. The heart will control the movement of the blood. So from the formation of the blood, we have mentioned quite a few times until now. As for Huangdi Neijing, the production or you use the formation of the blood. That's the middle jaw receives the qi, and then the qi travels to the heart. The heart transforms the qi into red color, then become the blood. Then you can see from the middle jaw receive the qi. The qi travel to the heart change the qi into red color, which become the blood. Then that's the relationship between these two, and the heart governs the blood, which governs the movement, blood movements. And also the blood, on the other hand, can nourish the heart, also nourish the spleen itself, because the heart, in order to function, to perform the heart function, the heart itself also needs the nutrition. That's from the blood. In this way, the heart also houses the mind or the spirit. In order to function well, you also need a support on the spleen, because the spirit or the mind need to function. Your mental or your psychological activities need to function. You also need the qi and blood. So the relationship between these two mainly focus on the blood, the mind, and also the source, formation of the blood. There's a patient have the symptom of fatigue, poor appetite, and detecting edema. And then this patient also may suffer from insomnia, poor memory, palpitation, or dreaming a lot. So if these two groups of symptoms happens in one patient, you can think about fatigue, poor appetite, that's from edema, also edema. These are due to the spleen, insomnia, poor memory. These are mental activities related to the heart. Palpitation, the heart beats, dreaming, the psychological activities. So these are actually the different activities, different examples in our clinic. You can see when you see different symptoms, we need to conclude to the roots. And then from the roots, we need to analyze, we need to understand what's the relationship between the roots, because we only can conclude into one, maximum two roots. It's rarely to have 3 or 4 different root causes. So we need to understand, such as the insomnia, the poor memory. In Chinese medicine, the insomnia is due to the heart doesn't have enough heart yin, which can be the blood or body fluids in the heart. Then will cause the disturbing of the heart, cause insomnia. That's why in the treatments, how are we going to treat the insomnia? We're going to nourish the heart yin, or we're going to nourish the heart blood. Then we can nourish the heart mind, can treat the insomnia. The next relationship is the heart and the liver. These two also focus on the blood and the mind. This mainly focus on the blood and the mind. The heart governs the blood. The liver stores the blood. As you can see here, the governs and stores, and also liver, also in charge of the qi flow, the qi movements. So these two, when they work together, it can help assist to prevent bleeding, also can help to prevent blood stasis. So these two, when they work together, they can control the certain circulation, which can benefit the blood circulation to avoid blood stasis, which is the poor circulation, or excess circulation, which is bleeding. The blood also can nourish these two organs. The mind and emotion. The emotion actually also a kind of mind, because emotion is a kind of feeling. It's a kind of psychological activities. So these two are actually speaking of the same stuff, but the heart houses the mind, and also the emotion. In the mind include the emotions, and the liver help the qi flow, which is important for the qi flow of the mind. The qi flow, the proper qi flow, is also based on the blood movement, sufficient blood movement, which is from the heart. In the pathological changes, the heart, especially for the blood deficiency, the patient may feel palpitation, insomnia, such as the symptoms we mentioned in the previous slides. The patient also may suffer from irritate. It's due to the liver yin deficiency or liver blood deficiency. So these two sometimes happens together. The next relationship we are going to talk about is the heart and the kidney. The heart and the kidney is one of the most complicated or one of the most important relationship in the organs. They mainly refers to the fire and the water. The heart in 5 elements is fire. The kidney in 5 elements is the water. So these two, the relationship between the heart and kidney mainly reflects in the relationship between the fire and the water. What's the relationship between the fire and water in 5 elements? They actually control each other. The fire The fire control, the water control the fire. So which means the kidney. So the heart fire is yang, the kidney water is yin. The heart fire, we talk about the heart yin and heart yang. Heart fire is considered as the heart yang. The heart yang need to go downwards. So the fire need to go down. The kidney water need to go up to assist the heart fire, to control the heart fire, to control the heart not generate excess heart fire. The heart fire need to go downwards to assist the kidney water in order to warm the kidney, to keep the kidney yang. So as you can see here, these two they control, and then one's moving up, one's moving down. This is very similar to the spleen function. When we talk about the middle jaw, the spleen and stomach, one moving up, one's moving down, then the circulation can be created from the movements. One move up, the other side move down. So this circle can start spinning. That's the circulation, right? So that's the kidney and fire. This is the physiological condition, such as if in the pathological changes, such as the excess fire in the heart. If we have excess fire in the heart, there's not enough water. It goes up to assist the heart because excess fire in the heart. This fire will consume the heart's yin. It's very similar when you cook water or when you cook your soup. The soup keep boiling, you keep the fire, you keep the heat there. The soup going to be concentrated, which means in volumes you got less water. That's the yin deficiency. Will cause the heart problem. In this condition, you need the kidney water to assist. And also the heart and kidney, the relationship between these two also can reflect in their functions. The heart governs the blood, so the heart is related to the blood. The kidney stores the essence. Blood and essence, they can mutual generating. Because the essence can generate the qi. That's where the blood comes from. So always the tip to understand the relationship between these two, always try to find the agents in between. Which materials, which substance is common in these two organs? They share in these two organs. The heart fire, we use the kidney water. Actually for the kidney water is the kidney yin, kidney yang. Kidney also have the yang. So kidney yang we also call the kidney fire. Then we have two fire in the body. You still remember that from the 5 elements in the video that I show you. We're going to put the 5 elements in your joints of your fingers. It will help you to easier to understand or to remember. But when we use the wood, the fire, then we skip the middle finger. We go to the ring fingertip as the earth, right? The index fingertip and the middle fingertip. Why we skip the middle fingertip? That's because the fire, because 2 kinds of fire in the body. The heart fire and the kidney fire. So the index fingertip is the heart fire. The middle fingertip is the kidney fire. That's why we skip one to the earth. of the ring fingertip. The relationship between the heart fire and kidney fire. The heart fire is considered as the emperor fire. The kidney fire is considered as the prime minister fire, which means the heart fire is dominant. The kidney fire needs to support the heart fire. So that's the relationship of the fire in terms of the fire. The pathological changes of the fire and water. There's many examples there, such as if some patient they suffer from like men's problem, and then that's the kidney, because this is related to the kidney. And then in the meantime, the patient also may suffer from insomnia or poor or dreaming, sleeping, they dream a lot or irritate. So these are due to the disturbing of heart mind. Then in this condition, that's because the heart fire have excess heart fire, the kidney problem, the water and fire. So that's the imbalance of the water and fire. That's from the treatments. What are we going to do? We're going to balance the fire and water. That's how to treat this kind of problem. The lung and the spleen. Many focus on the production of the qi and the water metabolism. The lung and the spleen. The spleen, that's where the acquired qi come from, and then the qi absorbed from the spleen. The spleen need to transfer the qi to the lung, then the lung can disperse the qi to other organs. When we talk about the qi, the water metabolism, they are the same. So the water also absorbed from the received from the middle jaw, which is the spleen and the stomach, and the spleen and stomach also transport the clear water, the water we need, to the lung, and the lung disperse. So that's the relationship. And also from the 5 elements, you will see the relationship from the lung and the spleen. The lung is the metal, the spleen is the earth. These two are in the relationship of mother and son. So the earth is the mother of the metal. But for lung deficiency, and result after a long time results into spleen deficiency, then we call the son's elements problem affects the mother elements. On the other side, if the earth affects the metal, which is the spleen deficiency affects the lung deficiency, called the lung deficiency. Because the mother elements affect the son elements. What's the symptoms of these? Is this: for the first, the lung affects the spleen. The most common situation, especially in South Africa, we have a lot of TB patients, especially the lung TB patients. So the lung TB patients, they will have like cough, they will have mild fever, sometimes coughing blood, and then after a long time, they lose weight. They got poor appetite, as you can see from here. The coughing blood, the mild fever, that's everything. We talk about the lung TB. So that's from the lung. After a long time, patient suffer from poor appetite and they lose weight. That's the muscles and the spleen functions. That's from the lung affects the mother. That's the son's elements problem affects the mother's elements. So that's the clinical examples of the lung and the spleen. And from the spleen from the mother affect the son. From spleen deficiency, especially for some patients with poor appetite, after a long time, sometimes they will generate in lung deficiency. They will have coughing, or they don't want to speak because they don't have enough qi. As the spleen deficiency will cause qi and blood deficiency, which can result in lung qi deficiency. In this condition, the patient will speak a very low voice. That's because they don't have enough qi. Or sometimes they can suffer from they can suffer from the cough. And for this kind of coughing, for the treatments, we are going to focus on the spleen. We're going to tonify the spleen, and then that's going to assist the mother elements that can help the son elements. So that's the relationship from the 5 elements as well. So the relationship between these two, let me focus on the qi and water metabolism. And these two from the 5 elements are the examples for the pathological changes in our clinic. How are we going to use these theories? Because from lung deficiency due to the spleen deficiency, there's also a kind of relationship between the products of the qi. The next is the lung and the liver. The lung and the liver mainly related to the qi flow, and also the flow of qi and the movement of qi and blood. As from the functions of the lung and the liver, we discussed that the lung controls the qi, which include the innate and also the acquired qi. The liver stores the blood. The blood is the carrier of the qi. So these two are closely related. The lung qi, the qi of the body, needs to move over the body. It needs the carrier of the blood, which is stored in the liver. The liver also needs qi to promote the blood circulation. So in the pathological changes, the liver fire and lung yin. The liver fire can consume the lung yin. That's someone suffer from headache and irritation, and then they also can have dry cough, coughing blood, or chest pain, fever. These are the symptoms of lung yin deficiency. There's also sometimes in Western medicine, they also use similar treatments, although they don't realize this kind of theories. There's one patient that I saw last month. She was a lady and she suffered from dry cough for quite a few months. And she went to the local hospital. She had everything tested, and everything turned out to be negative. The doctor told her that the best news is you have nothing wrong. But you can see that the patient was keep coughing for a few months. From the medical test, from the examination, from the blood test, nothing was wrong with the patient. Then what can you do for this kind of patient? The doctors gave her antidepressant. So he thought that the coughing is from the depression, is from the anxiety. But as you can see for that lady, she's a very positive patient. She will never be an anxiety or depression. Obviously, the treatment doesn't work, but in this phenomenon, the cough, and then there's nothing wrong with the examination and the test. So they gave the antidepressant. In Chinese medicine, antidepressant is to help the liver, so irritation, this kind of emotion. That's the liver problem, affects the lungs problem. As you can see, this also, we apply this kind of treatment in Chinese medicine. In Western medicine, they also use similar treatments, although they don't know the reason behind this kind of treatments. But as you can see, this kind of treatment only apply in this cause. The liver fire causes the lung insufficiency. The dry cough due to the liver fire will only work. That's why this patient, when she was prescribed the antidepressant, this antidepressant doesn't work on her. After taking for a few weeks, she was still coughing. So that's the relationship between the lung and the liver. The next one we are going to talk about is the lung and the kidney. The lung and the kidney mainly refers to the breathing movements and the water metabolism. The breathing movements we also have mentioned quite a few times. The lung governs the qi. The qi includes innate and acquired qi. From the acquired qi, we also includes the breathing qi. But in order to have a proper breathing, we need the kidney function to receive the qi. So when the lung breathes the qi into the lung, the kidney need to pull the qi downwards to increase the normal breathing. Otherwise, we will have very shallow breathing. Goes in very shallow and goes out. Inhale and exhale. It will never goes down to the kidney. So that's the function of the kidney, receiving the qi. The second is the lung yin and kidney yin. Kidney stores the essence. So we have introduced quite a few in this videos. We're going to stop here today, and we're going to continue in the next videos. Thank you guys. So guys, that I realized there's one of the last parts of the information that was not recorded. So I'm just going to repeat here for a few seconds. That's the lung yin can benefit the kidney yin. That's from the 5 elements. The lung is the metal and kidney is the water. The metal can generate the water. That's why we say the lung yin can benefit the kidney yin. And the kidney yin, the essence, the yin in kidney, which is from the innate yin, from the innate essence, also need to be benefited from acquired yin. That's also parts of the lung yin. So these you can also explain from the 5 elements, apart from the breathing movements, water metabolisms, and also from the 5 elements, and also from the pathological changes. You can see the disorders of the breathing and then the water metabolism, such as edemas. So in this kind of problem, sometimes in the treatment we will treat both of them, both of the lung and the kidney.